Good afternoon, everybody. It's Dr. Galvin with today's coronavirus update. We're going to start spreading things out a little bit. We've hit a bit of steady state with this virus. We're heading into some of the phase 2 of the openings, and things are not changing on a daily basis like they have been. So I'm going to be spreading out the updates a little bit. We're going to be adding a little bit of wellness content as well. So today's going to be one of those days. We're going to talk a bit about the virus, and we're also going to talk about some wellness content. For those of you just joining us, my name is Jeffrey Galvin. I'm a physician. I'm board certified in emergency medicine and obesity medicine. I work in a local emergency department here outside of Charlotte, North Carolina, and I also run Vitality Medical Wellness Institute, which is a functional medicine clinic in Charlotte. As usual, we're going to start with the numbers. Worldwide, 5.9 million cases of COVID-19 confirmed. 358,000 deaths, 2.39 million recoveries. In the U.S., 1.7 million cases. Unfortunately, 101,000 deaths in the country, 375,000 recoveries. Here in the state of North Carolina, 25,000 cases, 827 deaths. I want to talk a little bit about a little bit of controversy from yesterday. I was on WCNC talking about the upcoming Republican National Convention, and I was on the news, and they asked me the question about what I thought about hosting the convention, and I said I thought it was a profoundly bad idea. And I just want to say that was not a political discussion. You know, I don't really reveal my own personal politics. I just answer that question in my medical opinion about cramming 20,000 people together in close quarters for 4 days in the midst of a pandemic. And the answer would have been the same if that was a question about a Taylor Swift concert or a monster truck rally or any of a number of other problems or other events. Democratic convention, that's just not a good idea at the current time, given the current situation. We can't predict what's going to happen in a couple months, and given the current virus situation, especially in Charlotte, where we have, honestly, rising number of cases right now, it's just not a good idea. Luckily, we do have some good news nationwide. It looks like the infectious fatality rate is a lot lower than what we expected. There is rising numbers of antibody testing that's showing that the infectious fatality rate may well be somewhere between 0.5 and 1%, far lower than the 5% that was originally thought when the cases started out being predicted back in early March and late February. Dr. Fauci actually made a prediction about this, I think, in an editorial in late March. And we got some very interesting news out of Indiana. There's a study that they did. They tested 4,600 residents doing two tests. They did two things. They did a COVID test to see if people were actively infected, and they also did an antibody test on those same people. And what they found was about a 3% rate of either people that were antibody positive or COVID positive, which is about 11 times higher than what was predicted, which is very good news because about 45% of those people were actually asymptomatic. And that bodes well for the nation if that translates out of, if we translate that out into the broader population. And if that's true, that 45% of people that ultimately contract this are not going to be symptomatic, that's very good news. Now, we've got to do a lot more testing. We've talked about that. But that, I think, is heartening news. And hopefully, as we do more and more testing, we'll get more good news like that. So today, we're going to try to combine some wellness content along with coronavirus. And so I'm going to talk about vitamin D. We've had a lot of people ask me about vitamin D. And I've got a supplement sheet that we've sent out to a lot of people. We've given to all our patients. And one of the supplements I recommend everybody take to kind of not to prevent, but really to improve your immune system is vitamin D. And why do we recommend vitamin D? Well, because vitamin D's got some profound immune enhancing effects. It's a potent immune protective agent, enhances our immune systems. And we've also got some fairly good evidence that low levels of vitamin D are associated with people that have developed fairly severe COVID-19 symptoms, in populations in particular that have been prone to developing severe COVID-19 and also COVID-19 mortality. In particular, minority populations, and a lot of minority populations are people of color. And we know that vitamin D deficiency is rampant in people of color, in particular because of skin color. Why is that? Well, people of darker skin do not produce as much vitamin D because of the skin color. We make vitamin D at the level of the skin from melanocytes, and because if we have darker skin, we need longer exposure, and we tend to make less vitamin D because we just don't get very much sun exposure these days. If you have darker skin, you make less, and then your vitamin D levels are lower. We also tend to not make vitamin D in the wintertime. And the flu season tends to occur in the wintertime, and we think that maybe low vitamin D levels make us more prone to viral infections in the winter. COVID started in the wintertime, influenza starts in the wintertime, and we think those all have a relationship. Vitamin D helps us with immunomodulation and also helps the function of immune-mediated cells, T cells, B cells, a lot of other things that help us fight off infections. So, vitamin D supports our immune function and our immune systems. Now, where can we get vitamin D besides the sun? Well, there are foods that contain vitamin D and supplements we can get vitamin D from. The important thing to understand also is that while we can get vitamin D from the sun, we actually don't produce much vitamin D from the sun between about October and April, and we think that maybe has something to do with the angle of the sun. So now it's May, so one way to improve your vitamin D levels is to get out and get about 10 to 15 minutes of sunlight every day without sunscreen on. That's not going to really increase your sun cancer risk. It's just 10 to 15 minutes. Don't get sunburned, but that much sunlight will improve that. The other thing is, vitamin D-rich foods, and those are things like fatty fish, salmon, mackerel, tuna, sardines. Other vitamin D-rich foods are things like egg yolks, D-enriched foods like enriched milk, enriched soy products. What else did I write on my list? Oh, beef liver, if that's what you like. Dairy, fortified orange juice, fortified cereals. The other thing is vitamin D supplements. And we want vitamin D3, that's the form that you really want. And typically 2,000 to 4,000 units daily is a safe amount to take. Now, sometimes your physician may put you on much more than that if you're severely vitamin D deficient, and your doctor will check that by doing a blood test. And you may be put on a much higher dose for a period of 6 to 12 weeks, depending on what those levels are. Doctors, I think the Institutes of Health say that they want a certain level. I tend to want my patients to have a much higher level. You got to talk to your doctor what they think is best. I have a particular level that I want my patients to be at that I think is optimal. But again, talk to your doctor about that. But I think vitamin D is very important. If you're interested in our supplement sheet, go to our website and submit our little online questionnaire, and we'll send it out to you. That's all for today. We'll be doing some more content. We're going to be doing more wellness content. If you like what you see here, please subscribe to our YouTube channel. Follow us on Facebook and like us on Facebook. I'll be back with more stuff later in the week. Wash your hands. Take care of yourselves. Take care of your families. Look after those around you. We'll see you soon. Have a great night. See ya.